What are the situations in which phase 4 of Korotkoff sounds are used to measure the diastolic blood pressure? Phase 4 diastolic pressure is measured in all hyperdynamic circulatory states, which include pregnancy, children, aortic regurgitation, thyrotoxicosis, anemia, and beriberi. Korotkoff sounds are divided into 5 phases, 1 to 5. Usually, phase 5 is taken for measurement of the diastolic pressure. Phase 4 is muffling of the Korotkoff sounds, and phase 5 is disappearance. Systolic blood pressure is taken at phase 1. In some cases of severe aortic regurgitation, if you go for phase 5 diastolic blood pressure, we may get it as 0. There is also a method of recording diastolic pressures at both phase 4 and phase 5.